Hello, my name is Dr. Chris Park. I'm an endocrinologist. An endocrinologist is someone that looks after conditions like diabetes, which is a hormone disorder. Currently, there are more than 1 million Australian adults with type 2 diabetes living in Australia. This translates about 280 cases of diagnosis per day, one every 5 minutes. So you can see that you are not alone if you think you're at risk of diabetes. As a health professional, I'm always told not to get personal, but I think in this case, I can tell you that I have both parents with type 2 diabetes. And the other factor is getting older, and I can certainly tell you that I am getting older. So these are two main risk factors that you cannot modify. The third factor, which largely influences your risk of type 2 diabetes, is lifestyle issues. I know, lifestyle issues sounds a bit boring, right? But this is probably the one thing that you can probably influence to reduce your risk of diabetes. Firstly, in order to reduce your risk, I think you need to stick to some routine. So your body really loves routine. It anticipates routine. It anticipates you're going to sleep on time and waking up on time and eating regularly. If you do things on the run, your body becomes quite stressed, which leads to increased stress hormones, and this leads to increased inflammation. And we know that stress hormones and inflammation are things that can lead to diabetes and cardiovascular disease. Watch the waistline. The waistline becomes quite important. If your waist is bigger than your measurements around your buttock, so what that means is that if you're apple-shaped, you are more at risk of diabetes than if you are more like a pear shape. As you get older particularly, we all tend to become little apple shaped, and you need to watch that. So the second factor that can help you reduce your risk of diabetes has two components. One is your relationship with your food, and second thing is physical activity. Firstly, I suggest that you adopt a healthy relationship with food. You can't really give up food, not like alcohol or cigarettes. And so when you're dealing with food every day, sometimes you might be eating something that may not be particularly good for you, but you should enjoy it, savor it, and you should then move on and try to eat healthy food most of the time. We generally suggest that you do about 30 minutes of physical activity per day. So it is clearly shown that people who exercise regularly actually reduce their risk of diabetes much more than any medications alone. So the third factor is management of stress. We all have to manage our stress, and we all deal with our stress differently. You need to find some technique, even with a professional help if you need it, to manage your stress. And my final comment to you is to see your GP regularly. See your GP about once a year at least to get a checkup. Because if you're at risk of diabetes, you're best off to find out you have diabetes early in its disease, because we know that if you manage your diabetes well early in its disease, it translates to better health outcome. You'll live longer and healthier. So what are you waiting for?